So I just got the state report for this accident that happened in January. Actually, the state wound up, because this is a hospital that accepts Medicare, Medicaid patients, the state essentially runs the basics of the incident investigation and report, runs it past CMS, Center for Medicare Medicaid Services, the feds, the folks who pay for Medicare Medicaid patients. So they run it past CMS, and CMS says, ooh, no, that looks pretty bad. We probably want to take a look at it. So CMS, in conjunction with the State Department of Health, investigate this. And I got the report from this. And it is wilder than I would have imagined, right? So this is a wheelchair or transport chair that is stuck onto in this MRI scanner. How did it get there? Well, it turns out that there was a tech aide, somebody who is there either just to support or maybe somebody who was in training to become an MRI technologist and was working in a support role. That detail isn't in the report. But there's a tech aide, and then there is the trained MR technologist. So the MRI patient is a child, and so that they have brought the child into the room. They have put the child on the MRI table, getting ready to start the exam. The parent of this young child is there, and wants to be inside the MRI scan room while their child is getting imaged. So there's no place for them to sit in this room. So the MRI technologist goes and gets a wheelchair, the easiest way to bring a chair into the room, I guess, to bring a wheelchair into the room so that the parent can sit there while their child is getting imaged. It's a whole question about whether the parent was actually effectively screened or not germane to why this is here. So the tech aide is in the process of putting the patient on the table and getting them situated to start their exam when the technologist wheels the wheelchair in. The tech aide positioning the patient sees with horror that the MRI technologist is bringing the wrong wheelchair into the room, yells at the technologist, "Stop, what the hell are you doing?" I'm making that up, and recognizes that in that moment the wheelchair is too close to the MRI scanner for the technologist to wrestle it back. And it is going. There is nothing anybody's going to do to stop that. The tech aide essentially tackles the patient who's on this table, which is probably sort of elevated up to the level of the tube, right? The tech aide tackles the patient off of the table to get the child out of the way of the flying wheelchair. Somehow, the wheelchair getting sucked in injures the MR tech somehow, some way on their neck, right? And they have to go and seek medical attention for the injury produced by the flying wheelchair. I have no idea who the individuals are that were involved in this particular incident, but I hope to God that the hospital gave that tech aide some kind of medal, some kind of exceptional recognition, that we have a tech aide who's essentially error checking the MR technologist about, that's the wrong wheelchair, what the hell are you doing? So number one, kudos to them for that. Number two, going to extraordinary measures to get the patient out of the way of the flying wheelchair, and putting themselves at potential risk in doing that. Kudos to them for a second thing. Like I say, I hope whoever that tech aide is got all manner of gold star recognitions for what they did in terms of protecting the patient in this instance. Now, because we discovered from the state and CMS report that there was an injury to a staff person involved in this, now our next step is to try and identify if there was an OSHA, Occupational Safety Health Administration, if there was an OSHA investigation and report into this same accident that might give some additional details that aren't in the state and CMS report. Anyway, absolutely 1,000% my heartfelt appreciation and respect to the tech aide. I have I have more questions than the state report answers about how on earth do we let this happen. This is why we do these event reports. Not to look and laugh and point at pictures of things stuck to MRI scanners, but to identify how and why these accidents are allowed to occur, right? And in this instance, also trying to identify the tech aid, and when we can, we want to identify and call out the positive behavior that can happen in and around negative events like this. So, good on you, tech aid, whoever the hell you are, and let me buy you a beer or something sometime, because you sure as hell deserve it for what the report says you did.